The World Health Organization, WHO, has released a new global estimate concerning the number of people living with disabilities in the world. The May 2018 report shows that there are about 1 billion people living with disabilities on planet Earth. 20 million of them are in Nigeria. The WHO report, which quotes Stephen Hawking, said governments can no longer overlook the hundreds of millions of people with disabilities who are denied access to health, rehabilitation, support, education, and employment, and never get the chance to shine, unquote. This is why we have dedicated this edition of Nigeria Today to celebrating Nigerians living with disabilities. We will be looking at their achievements in the face of daunting challenges and disability and future challenges. How have the physically challenged persons in Nigeria been contributing to the development of the country? What can be done to harness their full potentials? All this and more are on the table tonight on Nigeria Today. I am Segun Ojelade. I'm being joined in the studio by Patience Dixon. She is the National Coordinator Advocacy for Women with Disabilities Initiative, a non-governmental organization. We also have another guest who will join us very shortly. But in the meantime, I welcome Patience to the program.
Thank you very much.
Now, we're talking the plight of the disabled, people living with physical challenges in Nigeria. From your experience, both as somebody living with disability and the work that you've done in your NGO, what is the current state of people living with disabilities in Nigeria?
Thank you very much for that question. What is the current state of people living with disabilities? Not so good, but we are not below, as one would have thought, because I remember when I was a growing child,
Yes.
and I remember that we struggled to even go to school, especially looking at our background as coming from parents who are not educated or who were not educated, and parents who are poor. And so we relied so much on the government, at least, to take responsibility of some parts of cost for us before we could attend school. But these days, it's no longer like that. There has been lots of awareness. People have been making noise all over the place. People with disability themselves, organizations of people with disabilities themselves, development partners, governments, even individuals are all making noise about people with disability, creating lots of awareness, and that has really helped. So parents now look at their children with disability and take them as other children, and so want to also be responsible for them just like other children. So I would say yes, it has increased, but we are not there yet.
You talk about your childhood. What are those things that you can remember that you feel these are very bad experiences that you went through, that you feel things have changed now, just like you said, the disabled children or children with disabilities these days won't go through it again? Can you remember any of such?
Yeah, I started primary school when I was 11.
Oh, 11 years.
That's not a good age to start. Yeah, because everybody had gone to school in my family, my siblings, even my younger ones were already going to school before I even dreamt of going to school. And what really changed was that somebody was just passing by my house one day and saw me playing in front of the house on the ground. And then he just said, oh, what are you doing here? Where are your parents? I have to come and see them. Apparently, he was a social worker. He has passed on now, blessed memory. But I don't always forget him because he made me who I am. And so he was just a social worker, and he took me to school. And I started school for the first time in my entire life at the age of 11. Well, my younger one started at the age of 5, 6, but I started at the age of 11. So that has changed, hopefully, even though I still know that some children are still at home. You know, they are still indoors. Parents still lock them. Depends on the kind of awareness that parents have, especially among the poor people, because they have to consider cost a lot when they take them to school. So in my own time, my childhood, my childhood education started at age 11.
When you got to school, if you look at when you got to school at age 11, what was it like in those days? Do you think children that are physically challenged these days, would they ever go through what you went through? If you look at your classroom, the environment, the people that you had to be in the class with, you know, and the facilities that are there, have things changed?
A bit or no, and no as well, because in my own time, it was just special school. We were just coming up at that time, and they were actually looking for children like me to go into those schools. So they were searching everywhere for children, and the schools at that time, they were all well-built facilities, and they have special teachers all over the place. But now, special teachers are no longer there. The schools now we are all advocating for regular schools, that people like me who are physical challenged can actually mix up with other children, except when the children have intellectual or psychosocial disability, and so they need special attention. But in my own time, we were separated. If you are physically challenged, you are all in the same class with all physical challenged children. But we didn't want that because of the social aspect. We were not able to mix with other children, so we can also mingle and share experiences and things like that. So things have changed. Might not be as good as before, might also be as better than before than now. Depends on how the situation is. Okay,
you talked about special schools and mixed schools. In your own time, you went to a special school, but now the advocacy is that
go to an inclusive school.
An inclusive school.
Yes.
Now, is it because of the stigma that follows a physically challenged person or somebody that is disabled? What do you try to correct in that? Is it because when you come out, somebody is going to tell you that we are better than you?
I think the idea behind inclusive school now is that children miss out a lot when they are in special school, because when you are in special school, you are enclosed. You only relate to a certain type of children. But when you are in an inclusive school, you mix with other children, and then children understand your disability, and they begin to relate to you and begin to grow and understand what disability means. And so even as they grow, they can interact, they can know each other and things like that. This is all much more on the social aspect of life, so that other children can mingle together and understand disability.
Okay, your center is advocacy for women with disability and girls. Even the women that are able-bodied, have all their physical faculties in good order, they are still having challenges in today's world. You hear of giving women attention, protecting their interests, right to education and the rest of it. How is it, even with the female gender that is disabled or physically challenged, what is their situation?
Well, we have been agitating that the other females should accept female with disability into their agenda. We still feel that we are marginalized, even we are all female. Even if we are all women, but women with disability are a bit marginalized. Why? Because, you know, when you see a person with disability, you look at the person, all you think about is this person needs help, this person is sick, this person is not well. That is all you see. In other words, I am on the wheelchair. You see my wheelchair before me. You are supposed to see me as a person before my wheelchair. But you see my wheelchair and you judge me and say, oh, this is a sick person. And so I am being regarded as a sick person. That is why we have different models of disability, where you have the medical model, the charity model, okay, you have the human rights model, which is what we are doing now. The charity model is, you see a person with disability, you give the person 10 naira, you say, oh, this person needs help, this person is not, so let me help. The medical model, she's sick, let me take care of her illness. And when you go to the hospital, the first attention is that, oh, she's on a wheelchair, let me take care of her legs. I cannot go to the hospital, people believe that I go to the hospital because I have malaria, because I have problem with my legs. So the first thing that will bring me to the hospital is anything that has to do with my leg. But in that one, we are now saying that no, that is not what we want. What we are agitating for now is the human rights model, which see us as people with disability. There's no absolutely nothing wrong with me, but something is wrong with the barrier that limits me to perform well in the society. And what are these barriers? There's no ramp, access, lack of communication for the deaf, lack of braille for the blind. All these things are barriers. These are actually the disability, not us. So when you look at women and women with disability coming together for other women to accept women with disability, there's still that barrier in between, because they still look at the disability and look at women with disability are not able to perform effectively.
So how are you addressing some of these things?
Yeah.
Don't tell me we are looking for government to do this, government to do that.
Yeah. Advocacy, awareness raising, change of mentality. So these are the kind of things that we are trying to advocate for. We just go in, we make people understand that, look, we are doing this now. I'm here, I'm talking. What am I trying to do? I'm trying to win people over to actually change their mentality, so that when they see people with disability, they look at them in a different way and in a different attitude, and raise awareness on their behalf, so that people understand how they are. So it still boils down to awareness raising. We have to sensitize our community, our grassroots community, our women, whichever, for them to know that these people are people first. They are people first before anything. They have a breath, they have the breath, they have everything. They are just human beings. Okay. It's just they have limitations that is
what affecting. Is the mindset of the physically challenged themselves? Some of them are still looking for some of these things that you are trying to advocate against. Like, yeah, if I see, okay, she needs help, give her some money. Some of them are still looking for this. Absolutely. They are still begging about. What is their mindset? The
mindset, it's, like you said, you rightly said, it's, majority of us are still the same. But, like I said, many of us are changing. And that is because of the work that a lot of people have done. A lot of people have been working even before we came on board. And even after we are no longer there, it will continue. Like I said at the beginning, I said we are not there yet, but we are gradually climbing up. Yes, people are beginning to change their mindset. People with disability, we are beginning to see ourselves as even helpers. Not every time we beg. We don't want to be beggars. That is why these days you ask a little child, what do you understand by disability? Say they are beggars. It's so unfortunate and sad, but that is how it is. So we need to really work on ourselves. One way to do it by training. I do a lot of training. I make people understand that you have to change your mindset. You have to work on your self-confidence. You have to have a very high confidence. For you to make an impact, even as a woman without disability, you have to double up your efforts. And then with a woman or a person with disability, you have to triple or even more than that, for you to be a role model for people to reckon with.
Okay, we'll continue this discussion. Earlier in the day, we went out on the streets to answer some of the questions that she has asked about how do Nigerians see if the disabled or people with physical challenges. We will take a short break. We'll take that clip, and my guest is still here.
Yes, actually, we have disabled people all over the world, everywhere. But when it comes to Africa, especially Nigeria, they are neglected. Even if you go to some banks, for them to even find a way to climb the staircase is a problem for them. So, and we have some of them that are graduate. They are going to school. If you create school for them and you're not employing them, what is the need for them going to school? So, do you want all of them to turn to beggar? So, the best solution, look at where they are good, what they can do, and bring them in.
Understand something, that when someone is disabled, for instance, let's say someone that is blind, other senses tends to work better. You get. So if you look in that aspect, instead of sending the person to the village, or you say because you're crippled you cannot work in the engineering sector, maybe the person can create an app in the office.
It is not the eyes that matter, it is the mind that matter. That is why if you look at, basically, they will always tell you it is the battle of the mind, not the eyes. It is how far you can see with your mind that determines how far you will go with your life. But in Nigerian context today, if we can put the proper law and policy in place, I bet you Nigeria will be a better place.
Government should make more provision for them, should make spaces for them in offices, especially in offices like this, like federal offices. Give them like spaces. Some people, most of them are actually intelligent. They have things they can do, or services they can offer. People should not just look down on them because they are disabled. Should give them chance to work and see what they can do.
Seriously, we need prayer in this country. In anything we are doing, we have to take God first, because in the 10 Commandments, the greatest is love. When you love God, when you have love for God, you can love human being. So if you can love human being, you can love everybody.
Welcome back. The program Nigeria Today continues on the plight of the physically challenged in Nigeria. Now, you've heard some of the comments there. One very important one is that they talk about policy, somebody talked about law, somebody even talked about structures, special facilities for the physically challenged. And you said things are changing. Are some of these ones changing too?
Ah, what a question. No, they are not. That's just the truth. The truth is that for things to change, you have to start somewhere. And one of the ways to start is policies. You have to have a written document that people can look at and they follow. We don't have that. And even if we have, I am always saying it, and I will continue to say it, unless these documents have people with disability, women with disabilities, specifically in these documents, it cannot work. You cannot say, oh, they are for people, so you are all people. It will work for all of you. That is why people with disability are disappearing. The structures are not there, access is not there, nothing is there, because in the policies, they are people. They are not people with disability until they are stated there as people that have special needs. And for them to perform well, they need their special needs to be met. And so these structures have to take into cognizance those special needs. It will not work. So it's not there. It's not working.
Now, some people also said that, yes, okay, 2019 is around the corner, for instance. What is the aspiration, or what are the aspirations of people with disabilities for 2019? Are there some of them that will say, okay, I am ripe for elective offices? If there are, what are the barriers? What are those things that have changed? if there are people, some of them that say, okay, well, I want to vote, I have my PVC. What are those things on ground, even from INEC, to assist them to exercise their franchise?
Yeah, 2019 is coming, so there's a lot of noise all over the place. People with disability, I think we just heard in the world news, I mean the WHO reports, about 20 million people have one disability or the other, and they will definitely need their votes. But the truth is that if those people are not included according to their needs, they might not vote. For example, I am on a wheelchair, and you tell me to go and vote, and I go and vote, and the first thing I see is a barrier. You put whatever it is that I'm supposed to use up there, and I am not able to go in. And then you want somebody to lift me up to go and vote for somebody. Wow. I think we have always been meeting with INEC.
Or a huge crowd.
Definitely.
Of eligible voters, and you have to struggle
to go in.
Them to go in, yes.
Or even a blind man, or a deaf woman. Okay, you now need to relate with a personal assistant for somebody to vote. That is not right. Vote's supposed to be my own right. My right, not somebody to do it for me. And that is what happens most of the time. Okay, so unless the electoral body puts certain things in place to the needs of those people, let your let the processes and procedure also include braille for the blind, also include interpreters for the deaf, also take care of certain other barriers like ramps. You need to put ramps in place. If RAM is not there, then take the whole thing to a ground floor where we can easily access and go in. And then you train your personnel. It's very important. Very, very important to train your personnel. Let them understand people with disability.
How far, Abi, have you done any advocacy to INEC, for instance, on some of these things? I mean, not you, but the NGOs. Have you met anybody, I mean, to talk about some of these things that you are talking about?
A lot. INEC already knows. In fact, they have been having meetings with us. Even the last election, they had meetings with people with disability. Even now, it's still ongoing. A lot of advocacy is going on about. But INEC on its own has also improved, because the last time, I think, when we went to
Anambra
to vote. I mean, not to vote now. When the last election, during the last election, there were so many things that they tried to put in place. Yes, but it's not 100%, but it's no longer 10%. Okay? It's not even up to 50%, but it's no longer very low.
It's no longer zero.
It's no longer zero. Yes, it's climbing gradually. Well, they are also looking at some certain things like costs, because to take the needs of people with disability into structures, it entails a lot of money. It costs a lot.
Okay.
But like we always say, even when I travel abroad, they always say, look, cost should not be a problem, because it's all about human beings, and for people to function well, cost should not be a problem.
Okay. Now, you spoke about a social worker that saw you when you were young, playing in front of your house,
yes.
and that's what, to the glory of God, got you to where you are today.
Definitely.
But there are still parents that lock up their physically challenged children for many reasons. What will you say to such parents? Less than 1 minute we have on the program.
I'll just say what my parents used to say. My father is almost 100 years old now, and he always anytime we go and visit him, say, oh, we almost destroyed your life, because we didn't know. A lot of these parents are ignorant of the fact that children with disability can actually make a living in life. That's just the truth. Please, 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 they are human beings. Take them like your other children. Take them like your other children. Take them to school. If you don't have money for them to go to school, put them to go and learn trade, so that in future they will not be a burden to you.
And they will not cause your memory.
They will not be a burden to you, and they will not make you die quickly. So, but today, when my parents see me, they just look at me and they just say, wow, we cannot believe that this is you, that we almost destroyed our life. Because they had a kind of arrangement that as I'm growing up, I will be rotating from one brother or sister just like that. But look at me, I'm on my own. They are not thinking of me. In fact, I am the one even trying to also take care of them. So if you don't want to be like that, try as much as possible to take care of your children.
I must thank you, Patience, for all that you've said on the program, and even the work that you are doing to ensure that in Nigeria, the people living with disabilities are not just concerned to the lifetime of beggars.
Yeah.
So I must thank you for your contributions.
Thank you, sir,
on the program.
Yeah.
We've been speaking with Patience Dixon. She is the National Coordinator Advocacy for Women with Disabilities Initiative. Patience, once again, I wish you the very best.
Thank you very much.
Until we come your way, and that will be tomorrow on another edition of the program Nigeria Today. I am Shegun Ojelade. On behalf of my producer, Julieta Aino, good night.